happening for people who have Parkinson's who are in the hospital for an acute care bout?
Yeah, it's super interesting. I really wasn't sure what I was going to find. I think innately we know as therapists that we should be mobilizing people in acute care, everybody, but especially people with Parkinson's disease, but that's not happening. People are with Parkinson's disease are going into the hospital and they're coming out worse. The outcomes are worse. It's associated with certain comorbidities, so we'll talk about that tonight. Who's at most risk for backsliding while they're in the hospital? There are some specific comorbidities they found in the research that we can look out for. And then also, we look at what's kind of the number one and number two things that's not happening in acute care, and that is good medication management. And so we're going to be talking about what the research tells us there. I was really floored that this day and age that we still aren't getting the medications on time or in the right dosage or available at all, both for unintended hospital visits and also elective surgeries. So I also have some literature on should our patients be doing elective surgery. So just really, really fascinating things about maybe not how to treat people with Parkinson's, but all the things that
Right.
go into what we need to be thinking about when we have someone with Parkinson's in the hospital.
Because the main thing is they're in the hospital for something else. Like you said, elective surgery, or maybe they had a fall, or maybe there's an infection or another thing. And the Parkinson's is just a complicating factor that the team may not be addressing properly, right?
And really, more people are entering the hospital just with Parkinson's as their comorbidity. So they've got something else going on, and it's just a complication. The biggest thing is a lot of people still don't know a lot about Parkinson's. When they're a general hospital, they can't be an expert in everything.
Yeah.
And this is one of the areas that seems to slide under the radar for both physicians, nurses, and support staff.
So true. I know from when I was in inpatient rehab and working in med surg as well in the hospital, that was an area people just weren't as educated in because people with Parkinson's don't really go to the hospital for Parkinson's treatment. Like they're not really admitted for anything like that. And maybe it's rare that they're even seen in the hospital for some of these providers. Like they see a lot of other diagnoses really often. So I know they can feel like they want to do their best and help, and they don't necessarily know quite what to do.
I would say that one of the biggest things that we're going to talk about tonight is how you can advocate for your patients with Parkinson's. They have to be mobilized, and so that's the number one. And so many people in the hospital are afraid of the fall risk, but they have to be mobilized. So that's number one to advocate for. Number two is helping the patient advocate for getting their medications. We've got to talk to the doctors, we've got to talk to the nurses, and then also, really being the educational expert on Parkinson's. And so how can we get that information out there and do quality improvement for those folks? So we talk a lot about that tonight, and some give you some very specific kind of action items that we can do as therapists in the hospital. It was very, very insightful. I didn't realize how much research supported what we're all feeling as therapists. We know our Parkinson's folks are not getting moved and not getting their medications, but there's proof out there now that that is absolutely true.